Hello, and welcome back to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. Today, we are very excited to introduce our guest, Albert Katz, who is the co-founder and CEO of Flagler Health. Albert, thank you for taking time to chat with us today. Really appreciate you coming on the show.
Oh, thank you so much. And apologize for the blurry background.
No problem at all. Tell us a little bit about Flagler. What type of solutions are you guys providing to healthcare?
I guess like my third job out of undergrad was to be the CFO and eventually the COO of this like musculoskeletal practice. And then I went to get my MBA at Wharton. And then from there, I just thought of, okay, how can we create kind of like this virtual vertical care model for MSK clinics? And the thought at that time was like, okay, well, let's just do a massive roll up. We essentially got backed by this family office, me and my partner at the time, to buy a bunch of musculoskeletal clinics, and we would buy neurosurgery groups. The plan was to buy neurosurgery groups, orthopedics, physical therapy, and interventional pain clinics. And during this time, what we were working on was this like triaging tool. And this triaging tool would essentially take high-risk patients and move them up to the physician, and low-risk patients and move those down to the nurse practitioner or advanced practitioner, right? So essentially the high-risk patients who would need procedures, you could spend the most amount of physician time on getting the best bang for their buck and making sure that they get the best care. And just the patients that needed refills on their scripts, that could be done by an advanced practitioner.
Sure.
Yeah, and what we kind of figured out when we launched this pilot at Rush Medical was that essentially, if you added a couple additional filters, you could turn this triaging tool into a procedure recommendation tool, where you could actually train the algorithm to recommend which treatments patients were not only financially, but also medically eligible for.
Wow.
And that's when this whole idea came in, and when me and my partner decided like, okay, we're not going to do this roll-up play. What we're going to do is we're essentially going to make sure that we can essentially turn all of these regular clinics and private equity backed clinics into kind of help them transform into the 21st century, where instead of having to acquire these clinics, you can essentially leverage our AI services to provide you with not only patient triaging, but also patient scheduling, your virtual care management, like direct triaging to like the right psychiatrist if needed, behavioral health assessments. So it's essentially like a business in the box for musculoskeletal clinics, which involves like orthopedics, interventional pain, physical therapy, and neurosurgery.
Wow.
Yeah, so it's basically like AI for your clinic. I would say like that's the maybe best way to introduce it. You know?
Yeah, you mentioned training the system, so I assumed it's an AI-driven technology.
Yeah, and it learns just like any other solution off of the practice patterns of the user. So the user in this case would be the physician and the advanced practitioners. So as we make recommendations, if the practitioners decide not to follow those recommendations, the algorithm will learn from those recommendations and improve to practice in the same behavior as the practitioner.
Yeah, and it's so interesting because I think everyone would agree that healthcare is a bunch of ugly data that doesn't speak to each other.
Yeah. A lot of the work we do, to be honest, is just turning like cluttered, unstructured data into something that essentially is more structured, like something that's readable. Because I'm sure you know this, like physician notes aren't great. You know, the hardest part isn't building an algorithm that can recommend procedures and acting like a doctor. The hardest part is making sense out of a patient note.
Sure.
And yeah, that's the funny thing about all of this.
So tell me, with the variety of solutions Flagler Health is helping identify and fill the gap, what do you think is the biggest missed opportunity that most MSK groups out there were struggling with by doing things the old ways?
The similar problem that we've had in our clinic is you're putting out so many fires, and it's becoming more and more difficult for your clinic to just survive, right? Because reimbursements are going down, churn is increasing, like patients are always unsatisfied. it's just like selling to private equity or to a health system as your saving grace, and you're just
Sure.
trying to get economics up to a point where they're willing to buy you.
Yeah.
So I think the main thing that clinics uh the main thing that clinics can kind of look forward to nowadays is, especially with all of these tools, a lot of the back office and some of the front office work that is being done can greatly be automated. So it'll massively increase your margins. It'll decrease the inefficiencies. And like I would say that there are multiple ways for your clinic to not only offer more services for your patients, but to just improve your revenue generation. Because, for example, like I've said before, with our clinic, our old clinic, we wanted to offer the full line, and we didn't have enough money. Like we bought the first acquired a rheumatology group, but we didn't have enough money to acquire an orthopedic group and a physical therapy group at the same time. So we basically just tried a pilot where we bought a massive office space and we gave discounted rent to this large orthopedic group and this physical therapy group. And we tried to just handle the triaging and see how much money we could save and negotiate better rates for payers, right?
Sure.
And what we thought is like, okay, well, why don't clinics just offer these services virtually, right? And the reason why they can't is because a clinic would have to take a risk, hire a like a physical therapist or an orthopedic surgeon, and keep them in the clinic and make sure that they're getting the right amount of patients. And what we do is we'll take all the risk for you. We'll triage the patients. We'll hire those physicians under our own company, and they will just subcontract under your clinic, and essentially you will generate all the revenue and you'll pay like a fixed fee for service to us, which is less than what you generate. So we're basically helping you like grow out your clinic and extend as far as you can without having to take any underlying risk.
What are some objections to investing in AI or fears that you've heard as you try to scale your platform that doctors, feel threatened or see any negative effect of bringing AI platforms or technologies into their practice?
So I would say the evolution of this is quite funny or entertaining, at least. We first came out with this in 2002 before ChatGPT was a big thing. And when we kind of first hit the scene, no one believed that we could do it or were even doing it when it was working.
This was 22?
2022, yeah. So this before like OpenAI was becoming somewhat of a thing, but no one really knew about it except for like the nerds, really. Like
Sure.
just the people deep in the space. I just remember every doctor saying like, "You, this is ridiculous. This will never work." And
Mhm.
then one day, I think in the end of 2023 or beginning of 2024, OpenAI is really picking up steam, and then sales become so much easier because doctors are so much more excited to see like they believe AI can do more than what it can actually even do today, right? So I think before there was no real fear. It was more like this is just like never gonna work. It's like voodoo. And now it's like this can solve all of our problems. Um,
No middle ground.
yeah. I think the people that are concerned most with AI and the majority of the pushback are really just, I would say, like the lower, like the medical assistants or like the phones people who essentially see that their job that required, let's say, a team of 10 can now be done with a team of 4 or 5. And I think that's where the majority of the concern and pain points we're seeing and where a lot of the pushback has been.
Sure. Yeah, that makes sense. Now that it's more widely adopted, Chat GPT is now a household brand. So that makes sense that doctors went from this will never work to how do I implement this in every facet of my practice?
Yeah.
And where are you seeing it as low hanging fruit of like, okay, this is where you can start to save labor?
So the lowest hanging fruit, honestly, is for us, and it depends on the type of clinic. So for interventional pain clinics and spine ortho clinics, it's the triaging tool where essentially we're optimizing the physician's time. But
Sure.
for every other specialty that we work in within the MSK space, it's really just the remote care services that we're offering. So that's mostly remote therapeutic monitoring and chronic care management. And the next thing that we're releasing next month, not sorry, not August, but the month after, is going to be behavioral health integration, where essentially we're going to track patients' behavioral health. That seems to be the lowest hanging fruit because it falls into the major principles that we kind of strive, that we kind of follow whenever we're building any product, which is one, you have to improve patient outcomes. Two, you have to either increase revenue or decrease expenses.
Sure.
And three, you cannot affect the physician workflow at all. Like
Yeah.
you can't single thing, you can't make them hit an additional button. It
Yeah.
needs seamless, right?
Sure.
So everything we build is deeply integrated into the EHR. It just works. Like you don't need to change anything. They don't need a 3 meeting onboarding call. It's 15 minutes. Introduce me to your IT team. Tell me who the office manager is, and then tell me who your billing team is, and everything else is kind of taken care of. You know?
Extremely turnkey.
Yeah, all turnkey.
It's
Just
interesting you said you are integrating behavioral health. How important is behavioral health to pain and MSK?
oh, so important, right? Like I'm sure you know because I know you work with some MSK clinics yourself. It's so pain is certainly subjective and maybe some can argue objective, right? And a lot of it, what you'll see is like a lot of these interventional pain patients and ortho patients, specifically ortho spine, are on high doses of opioids, right? And
Sure.
especially when you're on these high doses of opioids, you need to keep track of your mental health, right? There's things that you need to be aware of as a physician, like is there substance abuse disorder?
Mhm.
Um, are they depressed? Are they increasing dosages? And if you are a doctor with 2,000 patients that you have to manage every year, it's impossible to keep track of all of that, right? And right now, clinics aren't doing it. So what we are trying to do essentially implement again like a turnkey form that goes out to every patient that's scheduled, and we'll essentially ask them on this 10 questionnaire, how are you feeling? How's your mood been today? Overall, do you feel like active? Are you happy? Would you consider yourself a happy person? And these questions that have just been approved by CMS essentially give us some gauge as to how mentally unstable or unhappy a patient is.
Sure.
And I think it's super, super important because that's one of the things we could be doing today to help battle the opioid crisis.
For sure. I mean, not even just the opioid crisis, which we know is a massive problem in MSK, especially interventional pain, where they're trying to walk this fine line of, I don't want to get my patients hooked on a strong opioid, but I don't want them to suffer. So it's a
Yeah,
really challenging situation that ultimately these doctors want the best for their patients, but they don't want them to suffer. But
yeah,
then when you have an injury or degeneration, and it could be you getting older and your joints are going and you just can't be active like you used to be, or you had some type of injury and you're a more active young professional. Either way, those both come with depression.
yeah,
And up until recently, nobody would ever want to touch that side of treating someone as holistically, mind, body, and soul all has to be in tune for their injury to get better. But now I
yeah.
think you're starting to see, especially in interventional pain, how much better the patients do when you address the mental struggles with the physical pain.
Yes, 100% agree with you. 100% agree with you. It, it's and it is. I mean, to your point, it is very difficult for a physician because working with so many groups, you can see that no physician wants their patient on opioids. Like that is the last thing that they want. But there are multiple times where there are no alternatives, right? Like a patient is in severe pain and you
Yeah.
cannot reduce it. So you have to be better about monitoring it, right?
Yes.
Yeah. And to your second point, it's like depression is a real thing. And I don't think that we've been monitoring that well enough. And I don't think we've created very good analytics around how to measure depression, right?
Sure. Or what to
Yeah.
do when
Or
it's
what
clearly there.
yeah, yeah, yeah. One of the things that we were thinking of is potentially in year 2025, we're going to focus on all of the high risk patients, especially those that are suffering from depression, on better triaging them to the right provider, so that
Sure.
they can get the care they need. Yeah, that's one of the beauties of a startup is there's so many. You go in trying to fix one problem, you manage to do it, and then you find out there's like a million others, and now you just have to decide on like, okay, what takes priority.
Sure.
So yeah, mental health is definitely one of those. We have to tackle it from the right direction.
Yeah, I was gonna say it's not an easy problem to solve, but kudos to you for jumping in the ring.
Yeah, well, not yet, but we'll get there for sure. You know?
So
Yeah.
tell me, what do you see as who's going to adopt AI to improve workflows, have a competitive advantage? Is it the smaller, more nimble private practice, or is it the larger health system that has more resources and overhead to worry about? Where do you
Yeah.
see it fitting into the business model in the near future with private versus health systems?
So I may be extremely biased because I run a company that sells to like clinics, and whether they be small one to three doc practices or large private equity backed clinics. But I think the healthcare organizations that are going to adopt it first and be better at implementing the latest technology are going to be these SMBs, right? More so because they don't have a massive legal team that has to check every single box,
Yep.
right? They have one to maybe three decision makers that you
Sure.
really need to speak to pass anything. And for them, they don't have to work with like a hundred other specialties, right?
Yeah.
Like you're implementing any sort of AI, right? One, it's a nightmare to get into Epic. So it's very hard to get their data.
Sure.
And then two, unless you're launching some solution for a specific division within the hospital that is completely, um, I guess, like disconnected from the rest of the healthcare system,
Isolated.
yeah, isolated, then you're going to have a massive trouble, just technically speaking, connecting to all the different nodes.
Sure.
And in a clinic, it's just very easy because you just know, like, okay, this is the one or two, three specialties that I have to worry about. There's less than, in most clinics, less than like 80 to 100 doctors, and
Yeah.
they pretty much fall within the same branch. They code the same way.
Yep.
It's very symmetrical. Like things make a lot more sense from a technical standpoint, so it's easier to build these solutions.
Sure.
So that see like some of these large startups that are maybe sub 1 billion in valuation, they have maybe two to four customers that are hospitals, right? And that's their entire client base. The other direction you'll see is essentially startups like ours, where we're just going after clinics and of all sizes in a specific specialty. And it's mostly because the sales cycle for them are anywhere between 1 to 3 months, when hospitals anywhere between 1 to 2 years.
Sure.
Yeah.
And you hear a lot about providers and physicians trying as hard as they can to stay independent, um, trying to survive, like you talked about earlier, with the constant, shrinking of reimbursements, the inflation of labor costs and product costs, cost of service. So it's a constant battle to stay as a private practice. Do you
Yeah.
see the AI solutions becoming a David versus Goliath
Oh, yeah.
tool for these private practices?
Yeah. Yeah. The trouble is that's exactly how I want to frame it, and I wish I could, except we're also servicing the Goliaths. So like we're helping the big private equity companies that are trying to acquire more
Sure.
clinics, and we're also helping the small mom and pops that want to stay independent. I guess we're like the tide that's going to raise all ships,
Sure.
but yeah, but I don't think that. I think that those that want to stay independent with Flagler will be able to stay independent. And
Sure.
if they want to sell, they'll be able to sell with a better multiple and a
Sure.
higher EV.
Sure. What are you seeing happening first when you implement Flagler Health? Is it reducing costs or increasing revenue?
In the beginning, our first tool is all about one, improving the patient outcomes, but then two, increasing revenue. That's it. And and our second tool, which is the virtual care management, has again just been improving patient outcomes, analytics, and increasing revenue. We have not gotten to the point where we will decrease expenses, where we're focused on decreasing expenses,
Got it.
because it is much harder, I think, at least for a business, to offer a service to clinics that is cheaper than what they have now, mostly because if it is marginally cheaper, there's not enough reason for them to switch,
Got
right?
it.
Because they're very used to what they're doing. But if you are offering a service that they have yet to ever adopt that's generating additional revenue, that becomes much easier. So the goal for us is essentially to come in through the front door with any of the current services we currently offer, which right now, especially with the triage tool, there are no competitors that do the same thing. Open the front door, and essentially, after we continue offering additional layers of services, we'll start focusing on helping them decrease their expenses.
Makes sense. It's easier to get excited about new revenue opportunities that you haven't even entertained than saving 10, 15% a year on your costs.
Yeah. Like, I remember when I was managing a clinic, it was our after hours calls, and we were paying them, I think, like $33,000 a year. And then another company came up and was offering 28. And I was like, okay, it'd be good to switch, but then we have to spend however many meetings telling you exactly how we want you to direct patients. And for 5K, are we going to waste our time doing that? So we ended up not.
Yeah, it's a headache.
It's a headache. Yeah, it's a headache. I think it's just like in general, for just startups, because we're still early, but for those even earlier than us that are just, I guess, coming up with an idea or maybe trying to think about going out to fundraise, I think that it's really important when you build out your product and you decide that you're going to sell to clinics to understand the mindset of clinics in general, like not only the clinicians, but also the administrators who make those decisions. And as the example that Elliot and I kind of just ran through, they really, really want to make sure that you do these three things: improve patient outcomes, increase revenue or decrease expenses, and don't mess with the workflow.
Mm-hmm.
And like, once you get those three down, everything else is marginally, will only marginally make you improve. Like, focus more on revenue than expenses.
Sure.
Yeah, things like that. But those three principles, and I don't know, Elliot, feel free to disagree, I think those were kind of like the pillars that can help you like actually sell products to clinics. Because those are the things that I was focused on when I had to make these decisions.
Yeah, 100%. I would say from my perspective, having a healthcare creative and marketing agency, we have tried to help identify gaps in the patient workup or patient care for procedures that we are trying to bring to the practice, and they are always open to identifying those gaps or areas where patients might slip through the cracks. And if you could find a turnkey solution that you don't have to completely turn things upside down, then they're going to go for it all day long. But when you talk about changing systems, training, a lot of meetings, that's an uphill battle.
Amen. I totally agree with you. This is bringing me back. Bring 5 years. I'm like,
So let me ask you this, Albert. It feels like we're very much in the infancy of AI, not just in healthcare, across the board, every industry. But specifically, since we're focusing on your product and your solution within healthcare, and most of our audience are healthcare leaders and executives, where do you see AI going over the next 5 years for healthcare?
I'm thinking of it in terms of kind of steps for AI in healthcare, right? I think the first thing to note as to kind of why I'm outlining these steps in the manner is because of the moat around getting the data. Like it's very, very hard to get healthcare data. And it's also why there aren't many successful healthcare companies today, right? For us, we got very, very lucky to partner with large med tech companies and got access to like 2 million patients. And so we fed the model very well and it works very well. But I would say that there are the first real change with healthcare and AI is going to be scribes. So, for example, for I don't know, the past 30, 40 years, and definitely 20 for sure, physicians would essentially show up to physicians would show up to their patients. There would be a medical assistant or a scribe that would basically take notes on everything they're doing, right? And they would submit that to be reimbursed for whatever claim they build. That person can essentially be augmented or just completely removed with these AI scribe companies like Freed, right? And right now, it's such a popular space that there are like 20 very well-funded startups that are just doing scribing, right?
Wow.
It's a challenge, but they're definitely going to solve it. It's not, I can't say it's super easy to solve, but it's something that you can definitely with the right technical team, you can definitely solve. You could definitely figure it out, right?
Sure. It's right on the cusp.
It's right on the cusp. Like we're right on the cusp. They're doing fairly well. I've seen demos. I've talked to some founders who are in it, and they're directionally correct.
How wild
100%.
is it that sorry to cut you off, that there's that many well-funded companies just trying to solve that one little piece of a inefficient workflow?
Yeah, yeah. And I think that's how it's going to work, right? Like I don't think that um, any company that can essentially solve even like 20% of all the healthcare inefficiencies for every specialty is going to be like a $200 billion company, right?
Sure.
So I think what most of these companies will do is they'll try to break through with Scribe, let's say,
Yeah.
and then they'll find out exactly what the next product will be. And they already have this massive customer base, almost like an Amazon play, right?
Yep. Yep.
Um, I can't imagine them just being one company for just scribing, but we'll
Sure.
see. I don't know how it all plays out.
You got to break through
Yeah,
somehow.
yeah, yeah, exactly. Breaking through is the biggest challenge. And churn is almost never an issue in healthcare because most people just don't like once they have someone for something, they never switch. It's similar to why we have such horrible EMRs. Like
Yeah.
really, I can't think of any good EMR that's not Athena, ModMed, or even ECW. I'm not very happy with. So
That was
um,
actually a thought I had. Do you think AI will get all these fractured systems to speak to each other?
yeah, so that's there's some the majority, I would say 70% of EMRs are archaic. So like their code base is still whatever they built in like the 80s and 90s.
Yeah.
And there's been like these there's new laws that have passed. I think maybe I can't recall. It's been a while. 2008, 2012. Something about HL7 and fire compatibility, right? So essentially, it allows all of these EMRs to transfer data between one another and essentially create this one API that everyone can plug into. So the problem is that some large EMRs like ECW, Athena, Epic, those they are HL7 and fire compatible, but the majority of them aren't. And that's because the government hasn't really offered a carrot nor a stick
To
um,
to do it.
to do it. So once we get to this turning point where essentially they will charge like let's say an EMR company, I don't know, a tax for
Sure.
not being compliant, that's when we'll see a lot of um, EMRs either completely dying or changing their stack. Because,
Sure.
right, like from a technical standpoint, if your code is kind of built on Windows, let's say, to give like a non-technical standpoint, if like your program is built on Windows Vista and you've been on Windows Vista forever, it's really hard to like jump to, I don't know, like Windows 10 or whatever the new
Sure.
program, right? So like I don't think they'll be able to transform quickly enough, and eventually these other EMRs will just eat up those
Yeah.
customers. Yeah.
Yeah. Everyone's talking about consolidation in healthcare, but the most important consolidation we need is systems
Yeah.
consolidation, which you're not
Yeah.
seeing enough happen.
Yeah. Yeah. It would be great if we had like, I don't know, 4 or 5 really efficient EMRs.
I'm a
You know?
capitalist. I want to see options out there, but not 100 that don't work well.
Yeah. Not 100 crappy options. I totally agree with you. I wish they weren't so sticky.
Yeah.
But to go back to your point, I think the first tool is going to be scribing, certainly. Then the next are going to be back office AI tools. So let's say like billing automation is potentially one. And then afterwards, they're going to move into front office. And that's kind of where we are now, where we've really focused. Our first product was front office triaging, handling the flow of patients and making procedure recommendations, right?
Sure.
And we've kind of moved backwards because we were the first front office platform for in AI for MSK, got essentially connected to a lot of clinics, and we got to over 21 states in like a year and a half. So now we're moving back, and we're now trying to do essentially more back office stuff. So when we started offering these virtual care services,
Hmm.
started realizing that these clinics are having trouble billing. Like there's some really efficient billers, and they're great, but there's a lot of inefficient billers. Like
Sure.
there's a lot very bad old school, like same thing like EMRs. Like you have the Athenas, the ModMeds, they're great, but then you have like a no-name crap billing company that's also billing for a hospital that's been there since like the 90s, and like it's just one old guy with like a team of like I don't know, a team in Pakistan and Philippines that don't really communicate with one another,
Sure.
and collecting on like 60%. So
And
when
happy
we
with that 60%.
yeah, and so they don't even know. They're just like the money's coming in, it's okay. I'm
We
like
make our
you
percentage.
I'm like, do you realize what you're losing out on? Like, this is why your margins are so slim. But so we would go in there, we offer this RTM CCM, and then we are a bit upset because we're not able to collect all of what we're billing for. And so we go in, help their billers bill, and then we tell them, hey, your billers are operating suboptimally. You should really consider like either telling them to do a better job or replacing them. And that's kind of where we started inching our way into the billing process,
Sure.
where yeah, we're just trying to establish ourselves as kind of like uh, some back office support for the
Sure.
clinic. Yeah.
It's very interesting. Earlier in the conversation, we talked about how you go in trying to solve one problem, and then you
Oh,
lift up the hood and you find 10 other glaring issues. For you
yeah.
guys, your issue became we're not getting paid because they're not billing correctly. So let us go address that and see where we can create a solution.
Yes, yes, 100%, 100%. Healthcare is a funny thing, and I can't wait. A part of me doesn't want to age, but the part that I'm really looking forward to is seeing what it's going to look like in 30 years. Because I feel like now is finally the time where there are enough venture dollars and enough attention going into healthcare. Because if you think about it, the majority of the really smart people in healthcare, from the 70s to like early early 2010s, have been doctors, right? Because
Sure.
if you are very intelligent and you want to be in medicine, you want to be a doctor.
Sure.
But there's few very capable people that go into medicine and want to fix the administrative side of it,
Sure.
right? Yeah, and I feel like now there's finally this new generation, the millennials, and I think some of the Gen Zers that are starting to come in and want to work on not just being a physician, but being more of an administrator in like this massive issue we have in America, which is like just this massive spend on healthcare. It just
Oh,
inefficient, you know? Yeah.
inefficiencies everywhere. It's such
Yeah.
a land of opportunity if you look at it through that lens of
Yeah.
I want to create tools to run more sound businesses in healthcare.
Yeah. Literally. Literally. There's so much. There's so much, and there's so many different things. And honestly, like if I mean, God forbid we got like an offer and I got outvoted and we had to sell or something. There's like four other ideas because there's
Sure.
so many problems. There's so many problems. Jeez.
No,
Yeah.
I know firsthand. We've gotten ingrained in some operational sides of the business, and the reality is doctors are brilliant at treating conditions.
Yeah. I
You know,
agree.
they spend a lot of time getting trained and educated on honing in on their specialty.
Yes. Yes. And it's hard to be really good at that and then also like be the administrator for like your entire team, right?
In a
Like
very complex business model.
yeah, exactly. It is. It's absurd. It doesn't make sense. Like, why do we have PV? But yeah, like my chief medical officer, he is extremely bright, extremely articulate, but like he's never managed his medical assistants. Like he was like one of our, I think it was like our seventh hire in the old clinic, and him and I started Flagler together.
Nice.
Yeah, he would just like when he came into his office, he just had a team of medical assistants prepped and ready to go. He's never
Sure.
had to train them. He's never had to pick like, okay, which ones do I hire? How much do I pay them? What are the benefits? Things like that. So I can see why these issues are occurring and why some of these clinics are losing independence. But
Yeah.
yeah, the goal is not only Flagler, but for every other startup that's offering services to clinics, is to essentially take a lot of work off of a physician and let them be a physician and
Sure.
just make sure that their clinic is running like profitably and
Sure.
optimally. Yeah.
Yeah, it makes so much sense. And I couldn't agree more that we're finally, it feels like at that point where some of the brightest minds in technology want to roll up their sleeves and get their hands dirty.
Yeah. It makes me excited. It really does. I couldn't be happier. Yeah. And we'll
Well,
see we'll see the ride together.
yes, yes, I'm looking forward to it. I hope I got a couple decades left in me.
Yeah.
So,
Yeah. I'm going to avoid all buses.
yeah. Well,
But yeah.
Albert, it sounds like Flagler Health is just getting started with the impact you guys can make to give these doctors a fighting chance. So awesome work you guys are doing, and thanks again for your time today. We appreciate your insights, and I know our audience will have some great takeaways. If anyone is looking to learn more, check them out. Flagler Health. Thanks so much, Albert. I think I'd love to bring you back on for another podcast episode in a few months and see what's happening over at Flagler with some of your new rollouts.
Oh, that would be fun. That'd be fun. It's like a time capsule.
Awesome. Appreciate your time. You have a wonderful day.
Thank you. Thank you, Elliot. I'll see you.
Take care.